Hello, everyone. We are Group 4, which consists of Kayla, Jamie, Tiffany, Joanne, Taylor, and New. Today, we will be presenting on the prevalence of Ebola among adolescents in West Africa. Thank you and enjoy.
Extent of the problem. Ebola virus disease, also known as EVD, is a rare disease that can be fatal. It interferes with how the body clots blood. EVD causes issues with the body's blood clotting process and leads to internal bleeding. When the blood leaks from the blood vessels, it will cause inflammation and tissue damage. Ebola is most commonly found in West Africa. From looking at the map, we can conclude that the most prevalent species is Zaire Ebola virus, and the most prevalent areas in West Africa is Guinea, Sierra Leone, Liberia, and the Democratic Republic of the Congo. Mortality. Mortality is the occurrence of death in a population. According to the World Health Organization, the average fatality rate is around 50%. During the recent outbreak in West Africa between 2014 and 2016, there were 11,310 deaths. If you look at the table where they broke down the deaths by region, you can see Guinea had 2,544, Liberia had 4,810, and Sierra Leone had 3,956. At the bottom, it says the total deaths was 11,325, but that's including the deaths from other countries. Morbidity. Morbidity is the occurrence of an illness or illnesses in a population. The recent Ebola virus epidemic in West Africa was the largest Ebola epidemic in history. If you look at the table, you can see where they broke down Ebola cases by the month. By March 31st, 2014, there was a total of 120 cases of Ebola in Guinea, Liberia, and Sierra Leone. As the months continued, it reached its peak in November 28, 2014 of 3,559. If you look at the table, you can see after that month is when we had the steady decline of Ebola cases. By November 30, 2015, there were only 54 cases of Ebola, and by April 13, 2016, there was only 6 cases of Ebola. Guinea was declared Ebola-free in June 2016, and Liberia was declared Ebola-free by January 14, 2016. Economic impact. It was estimated that $2.2 billion was lost in 2015. And because of that outbreak, it lowered the investment that West Africa received, and they lost in 3 major categories: in the private sector growth, and agriculture production, and cross-border trade.
Ebola virus was first discovered in 1976 near the Ebola River in what is now the Democratic Republic of Congo. Ebola virus disease is a rare and deadly disease most commonly affecting people and non-human primates such as monkeys, gorillas, and chimpanzees. It is caused by an infection with a group of viruses within the genus Ebola virus. Of these, only 4 Ebola, Sudan, typhus, and Bundibugyo viruses are known to cause disease in people. Symptoms of Ebola show up 2 to 21 days after infection and usually include high fever, headache, joint and muscle aches, sore throat, weakness, stomach pain, and lack of appetite. The early symptoms of this disease feel like a lot similar to the common cold and influenza. But as the disease gets worse, it will cause bleeding inside the body as well as from the eyes, ears, and nose. Some people will even vomit or cough up blood and have bloody diarrhea. Extensive tests and diagnostic methods will be required to confirm that a person has been infected with Ebola. Ebola virus spreads from human to human through direct contact with bodily fluids of a person who is sick or has died from Ebola virus disease. This can occur when a person touches the infected body fluids or objects that are contaminated with them, and the virus gets in through broken skin or mucous membranes in the eyes, nose, or mouth. The virus can also spread to people through direct contact with the blood, body fluids, and tissues of infected fruit bats or primates. When pregnant women get infected, the virus remains in the placenta, amniotic fluid, fetus, and breast milk when they breastfeed their babies. Since people can get the virus through sexual contact, it is recommended that Ebola survivors and their sexual partners abstain from sexual activities or engage in safe sex with the appropriate use of protections until the semen has been tested negative twice.
So let's start off with primary prevention. What is it? Primary prevention is defined as activities that are designed to reduce the occurrence of a disease. These activities happen during the period of pre-pathogenesis, which is before the agent even interacts or reaches a host. An example on primary prevention include avoiding contact with individuals who have been infected and items that have been in contact with the infected patient, such as clothes and needles, as well as their blood or body fluids that can include their urine, feces, saliva, sweat, vomit, breast milk, semen, and vaginal fluids. It is also best to avoid contact with bats and non-human primates or blood, fluids, and raw meat prepared from these animals, otherwise known as bush meat, or meat from an unknown source. Another example of this prevention is to have the volunteers, doctors, and nurses wear protective gear when caring and working with Ebola patients. This can help by a lot to prevent the virus from entering the body. Lastly, education is another important prevention strategy that the public and communities can benefit from. It is important to know beforehand on how Ebola spreads, the symptoms one might notice or feel, and what to do to try and avoid contracting the virus. This can easily be the easiest and best way to prevent the spreading of the Ebola virus disease. Moving on to secondary prevention. This strategy is defined as an intervention designed to reduce the progress of a disease after the agent interacts with the host. This happens during the period of pathogenesis. An example of secondary prevention is early diagnosis. Early diagnosis can help better the chances of survival for the patient. This strategy can be tied with the primary prevention strategy of education so that people can know what these symptoms may be to be able to detect them as early as possible. A second example includes the concept of quarantine, which can be very beneficial for others surrounding the infected patient by preventing the virus from spreading to one another. On the left, I have a table that shows the Ebola virus outbreaks in West Africa to show how serious this virus was back in 2015. It shows 3 countries and the cases and deaths of each country, along with the number of healthcare workers that helped, and the number of deaths of some of these workers. The last prevention strategy is tertiary prevention. This strategy takes place during late pathogenesis and is designed to reduce the limitation of disability from disease. Therefore, this is after and during when the agent interacts with the host. It is best to manage the symptoms of the Ebola virus disease and focus on maintaining and increasing quality of life for the patient. This strategy is very similar to secondary prevention. An example of this strategy includes the concept of quarantine once again. Patients would still need to be kept away from others who are not infected to help reduce the spread of the Ebola virus. A second example of this prevention strategy would be continuous treatment. During this time, treatment can be done to monitor and manage the symptoms and to help the patient feel as comfortable as possible. Little to no suffering should be involved, and if the patient seems to be suffering, there should be ways to reduce the suffering until the patient is able to overcome the Ebola virus. To the right, I have a diagram that shows the 3 different phases of the pathogenesis of the Ebola virus disease. Phase 1 includes animal contacts, such as from bats, which then can lead to the entry of the virus from small lesions, which then can spread to lymph nodes, liver, and adrenal glands. Phase 2 includes macrophages or monocytes. Monocytes are a type of white blood cells and can differentiate into macrophages. Lastly, phase 3 can include fever, gastrointestinal symptoms, hemorrhage, and impaired immune response.
Before I talk about the host factors of Ebola virus, I will first define what a host factor is. A host factor is a person or animal that has a lodgement of an infectious disease agent under natural conditions. The risk of contracting Ebola is low for most but may vary between gender, age, and race. According to National Center for Biotechnology Information, or NCBI, women are more prone to getting the virus due to their occupation. Because they are nurses, caregivers, and birth attendants, there is a higher risk of exposure to the disease. Thus, pregnant women who have the disease are essentially putting children at higher risk of contracting it as well because children can obtain it through breastfeeding. Moreover, age also plays a role in one's susceptibility to contracting the disease. Research has shown that children under the age of 2 and adults above the age of 30 are more susceptible to the disease. This is because younger children are more dependent on others to take care of them. Thus, if their caregiver has the virus, they will also contract the virus.
The 3 environmental factors that are linked to the outbreak of Ebola in West Africa are location, poor health facilities, water, and sanitation. Location plays a big factor in the outbreak because some people are not close to any facilities that they can get help from. Even if they were able to reach a health facility, some facilities are damaged and are not capable of caring for patients. They also sometimes are understaffed and have little to no education about the virus. Lastly, their only source of drinkable water may be contaminated with the virus because of burial practices. Sometimes, people clean the dead bodies in the rivers where other people drink from, which can spread the virus.
Temporal variation. What is temporal variation? So temporal variation is the changes in environment over time with respect to a disease. The Ebola virus disease first appeared in 1976 in 2 simultaneous outbreaks in South Sudan and the Democratic Republic of Congo. According to Centers for Disease Control and Prevention, or CDC, research has shown that Ebola is the highest during transitions of wet and dry seasons, with a very irregular pattern, which makes it unclear how it varies within time and space. With new technology of satellite imagery, there have been multiple findings that the spread of Ebola occurs more often during the onset of the dry season, or summer. Other research has shown that there is a correlation between human population density and increased risk of Ebola spillover. For example, areas like West and Central Africa are highly populated, thus there is more of a chance of having outbreaks versus other regions in Africa.
The following slides will be explaining the gaps in knowledge concerning the Ebola virus. When it comes to research, it is still unknown on how the Ebola virus is transmitted. Although it is not confirmed, researchers believe that the Ebola virus is animal-borne. Bats are believed to be the main source of the virus. There is also not enough information regarding the early signs or symptoms of the Ebola virus. This information is needed to reduce Ebola morbidity and mortality rates. Another gap in knowledge includes how researchers have yet to develop an effective vaccine to not only prevent Ebola but to also treat Ebola patients. There are potential vaccines being tested, however, the vaccines lack long-term effectiveness and durability. With that being said, there are currently no vaccines available for the Ebola virus. According to Georgina Peacock's Ebola virus disease in children article, the health of adolescents is likely to be seriously impacted because of challenges to providing routine care, for example, immunizations and hospitalizations for common illnesses in affected countries. This leads to the gaps in knowledge within the target population. There is very scarce information on Ebola that it may be discouraging for people to feel safe. According to the World Health Organization, the little information about the patient's condition, outcome, or even the place of burial regarding Ebola leads to the stigma against people diagnosed with Ebola virus. This stigma has resulted to the seclusion of many people who are infected with Ebola as well as their families. Not having a curative treatment for Ebola has also led many people to only find hope through religious faith. Therefore, some people choose to see a traditional healer or herbalist rather than seeing a health provider such as a doctor or nurse to treat their Ebola. Many new cases were traced back from contact with these traditional healers.
Suggestions for further research. Public health and education is important to reducing the outbreak of Ebola in West Africa. There should be more research on knowing where the virus starts. The first step to this can be looking more into the bats that carry the virus and how they are able to transmit the virus to humans. Another way is research on other ways the community can come together to help reduce the spread and how staff can be properly trained and educated about Ebola.
In conclusion, why do we deserve $100 billion? Based on the severity and gaps in knowledge regarding Ebola virus cases, funds are needed to improve the health of adolescents in West Africa. Funds would be needed for more research on the transmission of Ebola virus, such as discovering more symptoms or early signs of Ebola. The funds would also help and support researchers develop a long-term Ebola vaccination. The funds would also help repair the damaged health infrastructure in West Africa. This includes maintaining and improving health facilities in order to be more reliable to patients and their families. The funds would also go towards hiring more professional health providers, such as doctors and nurses, to satisfy the demand for health services. Emergency transportation services are another necessity in South Africa. Emergency transportation can reduce the morbidity and mortality rates of Ebola cases because there would be faster access to health facilities. And lastly, we need the funds to provide education on how to prevent getting infected by communicable diseases such as Ebola virus.